Hi, my name is Cheryl Green, and I'm going to be discussing the topic Enough is Enough, Confronting Workplace Bullying and Incivility. In examining data from the U.S. Department of Labor 2014 to 2030 projections, a national growth of about 39% of registered nurses in the United States is projected to exceed the demand with growth of about 28%. So roughly as a result, in 2030, there will be an estimated excess of over 293,000 RNs in full-time positions. In 2014, there were about just over 2 million RN FTEs, and since 2001, there has been an increase of 68,000 graduates from nursing schools, and in 2015, 158,000. So there's a projected of over 2 million new nurses, registered nurses, that will enter the workforce between 2014 and 2030. So an estimated of over 1 million RNs in full-time positions will exit the workforce. A decrease of RN full-time positions of approximately over 149,000 will occur as the RN workforce ages and begins to retire and/or reduces their hours to part-time or per diem. So with a net growth of approximately over 1 million full-time positions, the United States RN national workforce in 2030 is projected to be over 3 million. So the demand for RNs will continue with an overall increase in those full-time positions of about 795,000 plus between 2014 and 2030. Now, when we look at turnover intentions, 61% of nursing jobs will remain within a hospital setting, although the move in healthcare has been to be more so preventative and also placement in ambulatory settings. Nurses aren't staying very long at the bedside in hospitals. As new graduates, nurses statistically, about 65% of associate degree nurses and 75% of bachelor degree nurses are seeking further education and leaving the bedside. So patient outcomes and mortality rates are going to be impacted already, are starting to be impacted, and are predicted to be in the future by nursing outcomes and the overall hospital environment. When we look at why nurses exit healthcare facilities, it's usually burnout, staffing, job dissatisfaction, wages, and work environment. Interestingly, with all the great changes that have been happening in healthcare, despite the wonderful innovations and clinical ladders that increase wages and promotion-related titles, nurses still seek and want healthy environments, that is, healthy work environments. Bullying and incivility remain problematic despite the educational levels of nurses and can contribute to turnover intentions and also burnout of registered nurses. When we look at defining exactly what bullying is, it is the intentional disregard of another person with an exacting malice. So bullying is targeted behavior toward a specific person. The difference between incivility and bullying is that incivility often consists of acts by perpetrators that can be observed by onlookers as misdirected anger or frustration. For incivility, it's rude behavior, disruptive, discourteous behavior and speech exhibited by perpetrators. And it's basically used as an attempt to exude control or power and authority over another person. The need for power and authority may be related to an unresolved conflict, frustration, or insecurity. Also, it can consist of verbal attacks, lack of collaboration, condescending language, sexual comments that are inappropriate, blaming others, superficial listening, I hear you, disregard for interdisciplinary input, withholding information, and rude comments. Other behaviors indicative of incivility are devaluing and distorting, misrepresenting, lying and shaming, splitting, breaking boundaries, exuding, betraying, and or excluding behaviors rather, setting up the victim of incivility. So enough is enough with toxic workplaces, don't you think? So let's talk about toxic workplaces. Workers align with bullies and hope to be accepted or avoid conflict. This is what happens in these environments. Decisions are seldom made secondary to disputes of power and position. Alliances are shifted based on exchanges of perceived power or knowledge. Truth is seldom honored. Lying is commonly used to gain popularity and alignment with the current popular group or person. Dishonor is respected more than honor. And there's a decrease in productivity and poor outcomes for the quality of work for those that are affected. Or even those innocent bystanders, right? But when you're observing incivility and bullying and doing nothing, are you really innocent? Workers are stressed and may call out ill, frequently related to illness. Workers are symptomatic with headaches and gastrointestinal symptoms and anxiety, and there's a turnover staff at least every 1 to 3 years. Big symptom. Workers belittle one another or speak rudely of one another's ability to perform their job. So imagine being that young new graduate nurse or that older experienced nurse with 40 years, 50 years, 25, 30 years of experience and being targeted by that bullying and how all those years of experience start to crumble. They don't matter because you start to feel insecure because you're not valued. It's important that nurses learn to guard their hearts, and I call this the hollow. And I mentioned this in a book I'd written on academic and incivility also in the clinical environment. 2 environments, but nonetheless the same because it's the same profession. So incivility may cause the affected individual to feel hurt, sad, and misunderstood and embittered. These feelings, referred to as the hollow, are accompanied by perseveration of incidences of negative behaviors from the perpetrator to the victimized nurse and can lead to illness, both mental and physical illnesses. For nurses experiencing the hollow symptomatically, they tend to lack energy, enthusiasm, and focus. And these symptoms arise in part because of the perseveration component of the hollow. As nurses mentally recall negative words said to them and the situations in which they felt vulnerable and attacked by the bullying perpetrator, anxiety and frustration are heightened as events are replayed over and over again in that person's mind. So with work productivity in the hollow, nurses may feel overwhelmed by the bully's continuous attacks on their character and their abilities to perform the job. This can lead to nurses having the sensation that they are sinking and enveloped in a deep sadness. And so nurses affected by the hollow may experience intermittent periods of worry and anxiety, accompanied by perseveration on events at work involving the bullying or bullies and intermittent tearfulness. So your mind, like a tape recorder or like a recorder, is constantly replaying those very damaging situations, being set up, not listened to, lied about over and over again. And that's where the deep sadness comes in. So nurses experiencing the hollow will inevitably have a change in their work productivity, preoccupied in their thoughts with perseveration of the incidences of negative bullying, interactions, and affected nurses may have a decrease in their ability to concentrate, think analytically, concern patient safety, think logically, concern patient safety. The danger of the hollow for nurses that are in direct care practice is that intellectually, nurses' thought processes may become clouded and they may have difficulty critically thinking within the clinical environment. The latter may compromise nurses' care of patients related to their disrupted thought processes, secondary to what I call the hollow. So how do we treat the hollow? Nurses can overcome the feelings associated with the hollow by either deciding to leave their work environment, shared with the perpetrator, or request a change of shifts to avoid all interaction with the perpetrators, or report the perpetrators and seek the mediation help of a nurse manager or a human resource department representative. Additionally, nurses should seek counseling through their company's employee assistance program if they don't feel comfortable doing so and they want to be a part or separate that intimate interaction of counseling or therapy from the work environment altogether, then seek help outside using your insurance to get therapy and supportive counseling regarding treating the hollow, that deep sadness. Untreated, the hollow can develop fully into a clinical depression. So untreated bullying and incivility, looking at the news and how it impacts our fellow nurses. So Rhiannon Collins, an RN, psychiatric nurse from Wales, was 30 years old. She was engaged and a mother of 2 young children, and she committed suicide after being bullied at work. And Nurse Collins hung herself at her home in March of 2018. A 5-month investigation of Nurse Collins' death at the hospital at which she was employed revealed that she was reportedly bullied, cursed at by colleagues, and given the worst shifts. It's believed that as a result of the bullying, Nurse Collins developed mental illness and became obsessed with her parents and began exhibiting signs and symptoms of an eating disorder as a means to cope with the bullying. Enough is enough, guys. Nurses, we can do better, right? Up to 85% of nurses have reported being bullied at work during their career. And I could tell you more cases outside of Nurse Collins that are almost too numerous to repeat with regards to violence against nurses in the workplace perpetrated by their fellow colleagues. So up to 85% of nurses have reported being bullied at work during their career. 85%, guys, and I'm sure that's increased more so because that's data from the mid-2000s. Current, but still later. Report and escort a commitment. Nurses must be held accountable for behaving badly, starting with professional conduct expectation in nursing school. For licensed nurses, professional behaviors, if not consistently demonstrated, should be placed on a progressive disciplinary action plan. No change in the pre-licensure or licensure levels. Escort. Have eyes and ears, report and write it up. Advocate. Level up each report if needed to key stakeholders. Nurses, you have one body, one spirit, and one mind. Stay healthy. Tips for your next move: advocate for biannual educational sessions on bullying and incivility prevention in the workplace. Know the ANA stance on bullying. That's American Nurses Association. See something, say something. Escalate your reports of toxic workplace behaviors only after confronting the bully or bullies, and have a one-on-one about how you perceive their actions and vice versa. Listen. Don't be a martyr. If the workplace remains unhealthy after you have notified key stakeholders, just move on. Stay healthy. There's resources for us as nurses. Seek counseling to obtain objective insight. There's the National Suicide Prevention Lifeline. Call them if needed, 1-800-273-8255. Your life is priceless and should not be taken at the hands of insecure bullies and nurses to perpetuate incivility. Anyone perpetuating bullying and incivility, not worthy of your priceless life. Consult with your state's nurses association. Look at the code of ethics for nurses with interpretive statements. Already mentioned the ANA. Notify your immediate manager. Meditation or mediation, right? Mediation first at the workplace, that can be done through HR. Meditation in respect of taking care of yourself. Mindful meditation, prayerfulness, prayerful meditation, whatever works for you. Notify human resources. That can sometimes cause unintentional retaliation, but nonetheless, it should be documented. And always consult legal advice, especially if nothing's moving forward in the workplace and your depression's getting worse and it's impacting your productivity. Our patients are so important, guys, and we owe them to keep them safe. They're vulnerable. But then so are you. Get the help you need. I want to thank you for the opportunity to review and explain to you the importance of self-care in the workplace. And nurses, enough is enough. Thank you. My name is Dr. Cheryl Green, and I can be reached at greenc16@southernct.edu. If you have any questions, it's been wonderful presenting to you. Take care and enjoy the rest of the conference.